Hi friends. Welcome to Dentistry Love channel. Factors determining post selection. Post introduction. The primary function of a post is to provide retention of the core material. A post does not strengthen or increase the fracture resistance of a tooth. Ideal features of post: provide maximal retentiveness to the core. Physical properties compatible to dentin. Maximum retention with minimal removal of dentin. Even distribution of functional stresses along the root surface. Aesthetic compatibility with definitive restoration and surrounding tissue. Minimal stress during placement and cementation. Resistance to displacement. Easy retrievability. Material compatibility with core. Ease of use, safety, and reliability. Reasonable cost. Clinical factors influencing post and core restorations. Post length. Tooth anatomy. Post width. Canal configuration and post adaptability. Post design. Luting cement. Post length. The length and shape of the remaining root determines the length of the post. The greater the post length, the better the retention and stress distribution. It is important to preserve 4 to 6 mm of apical gutta percha to maintain the apical seal. Also, the post length should be equal to the length of the crown or 2/3 the length of the root, whichever is greater. Tooth anatomy. Each tooth in the arch exhibits anatomical characteristics such as root curvature, mesiodistal width, and labiolingual dimension. Hence, root anatomy dictates post selection. The roots of maxillary centrals, laterals, and also mandibular premolars, single-rooted, have sufficient bulk to accommodate most post systems. Molar posts should never extend more than 7 mm into the root canal from the canal orifice. Post width. An increase in the post width has no significant effect on its retention. However, the tooth restored with larger diameter posts is reported to provide the least resistance to fracture with a decrease in the width of the remaining dentin. The post should be surrounded by a minimum of 1 mm of sound dentin. Recommended post widths. For maxillary central incisor, it is 1.1 mm. And for mandibular it is 0.7 mm. Recommended post widths. For maxillary lateral incisor, it is 0.9 mm. And for mandibular it is 0.7 mm. For maxillary canine, it is 1.0 mm. And for mandibular it is 0.9 mm. For maxillary premolar or molar, it is 0.9 mm. And for mandibular it is 0.9 mm. Canal configuration and post adaptability. Canal configuration aids in making a choice between a custom-designed post and a prefabricated post. If the selected post closely fits or conforms to the canal size, it may be a more conservative option because less dentin removal is required, thus enhancing the resistance of the tooth, as well as retention of the post. A well-adapted cast post and core restoration will be more retentive than a prefabricated post that doesn't match the canal shape. A recent investigation regarding custom cast posts reported a success rate of more than 90% after 5 years in function. Luting cement. Cementation plays a significant role in enhancing retention, stress distribution, and sealing irregularities between tooth and post. Most common luting agents are as follows. Resin luting cement. Type 1 GIC. RMGIC. Zinc phosphate cement. Post design will be discussed in my following video. Thank you friends. Please do subscribe for more videos.